Open disclosure forms a critical component of the clinical incident management process. When there are avoidable deficiencies in the care that we deliver, open disclosure is our opportunity to apologise to our patients and their families for the harm we have caused, and to be transparent in our efforts to understand the reasons why and put in place strategies to avoid similar harm in the future. Even when we are unsure whether harm was or wasn't avoidable, it's important to engage with the patient and or their family, letting them know that we are investigating and that part of this process we are keen to hear their perspectives. WA Health has adopted the Australian Open Disclosure Framework, developed by the Australian Commission on Safety and Quality in Healthcare. This framework sets out the basic elements of open disclosure, which include an apology or expression of regret, which includes the words, "I'm sorry," or "we are sorry." A factual explanation of what happened. An opportunity for the patient, their family and carers to relate their experience. A discussion of the potential consequences of the adverse event. And an explanation of the steps being taken to manage the adverse event and prevent recurrence. When a clinical incident occurs, the open disclosure process and the clinical incident investigation process need to work together in a way that is sensitive to patients and their families. Ideally, there will be a good flow of information between the clinical lead of the open disclosure process and the lead of the clinical incident investigation team. In the early stages of investigation, when the initial notification has been made into SIMS, it's a good trigger for the investigation lead to determine whether open disclosure has commenced. If it hasn't, sometimes this can be a good prompt for it to occur. If an open disclosure discussion has taken place, it's also good for the clinical incident investigation lead to understand what has been discussed with the patient and or their family. In the latter stages of investigation, the open disclosure and investigation processes come together again to make sure the patient and or their family is updated with respect to the main findings of the investigation and, most importantly, what actions are going to be made to make sure the incident will not happen again. Sometimes it can be useful to prepare a brief written summary in lay terms to guide the conversation and for the patient and or their family to take away with them. Alternatively, another strategy is to write the final report with the patient and family in mind, such that if it is requested and deemed appropriate, a copy of the final report can be provided to the patient without them having to go through a formal Freedom of Information request. Again, we see the important relationship here between open disclosure and clinical incident investigation. Even though open disclosure and clinical incident investigation are different processes undertaken by different people or teams, they are parallel and they need to work in synergy and certainly not at cross purposes. Both open disclosure and incident investigation are cornerstones of the clinical incident management process in WA Health.